Giving Fest live show today. Today we are welcome to Dr. Suresh Kumar Murugan for this platform, and we will talk about depression. Depression is a common illness worldwide with more than 264 million people affected. Depression is different from usual mood fluctuation and short-lived emotional responses to challenges in everyday life, especially when long lasting and with moderate or severe intensity. Depression may become a serious health condition. I just explain you about what is the WHS explanations, what is their data. So now I just wanted to introduce our today's speaker, Dr. Suresh Kumar Murugasan, done PhD. He is passionate professor, researcher, and mental health practitioner from Tamil Nadu, India. At present, Dr. Suresh Kumar is heading the Department of Psychology, the American College, Madurai, Yellow Pond Counseling and Wellness Center. Dr. Suresh Kumar is very keen new research studies and behavioral science and always open to learn. Dr. Suresh Kumar ultimate aim is to make impression in the field of education. His area of specializations are counseling and psychotherapy, positive psychology, education and psychology, etc. Welcome Dr. Suresh Kumar on Collective in platform. Thank you
Thank
so
you.
much. Yes. So we want to know about the depression as today's case or today's in this pandemic, after the pandemic and the pandemic, we heard many cases of the depression. So I would like to know about more about the depression, and our audience also want to know about from you what is the depressions and this thing. So what is the depression and why it is important to talk about depression? Can you just tell us about this?
Yeah. Yes, Ms. Anaga, I'm really happy to share my learning, knowledge, and experiences regarding the topic. And I can say that the ultimate aim of mental health service provider and service provider to create an awareness. And when you take out that top five mental health problem in any leading researchers, they will point out that depression is one of the leading mental health problem. And I would like to quote here Ramnath Kovind, our President of India. He mentioned in a meeting that the World Mental Health Day, he quoted that the data given by WHO, World Health Organization. World Health Organization, they labeled India as the most depressed country in the world. Most depressed country in the world. See, that means 1 out of 7 person in India are depressed. And
Okay.
so that shows that how much people are affected and how many people, if you ask them, be aware about are you depressed, many of them they are not aware about that they are experiencing depression. That is a sad reality. We have to accept it. And
Yes.
as you rightly asked, that first we have to understand that what is depression. And when you ask me that what is education, what is the psychology, and then we will define it, what is depression. I'm also curious to know that there
Yeah.
are many ways you can understand. When you ask that, if you ask a 10%, each person will give each definitions. But we have to
Okay.
accept that the scientific one, what it is says that I think we will be feel somewhat down. Some days in our daily life we feel that somewhat. Sometimes we may feel down, and we feel something lost, and we feel worry. And if it is continue more than a week, we can say that that is a person is depressed. That is a basic layman way to understand that. But what your researchers are saying that, our psychologists are saying that depression is a mental illness. It is
Right.
a severe mental illness, uncommon one, uncommon illness. What it is that? It is an experience or feeling of a person. I'm a person. I'm experiencing my feeling negatively, the negative experiences of my feeling, my thought, and my behavior. And sometimes we may notice that some of our close friends and relatives they behave in a way negatively. They usually they may not do that, but if they do, it is because of the depression. And it is an
Yes.
easy way we can understand that. Very simple. No, it is a common illness, a person who experiencing negative feelings, negative thought, and negative behavior. So that is the easiest way we can understand. And second question, as you asked very well, that why we are need to talk about depression. Yes, it is a right time need to talk about it because
Right.
we are aware about it, the epidemic and pandemic. And after COVID-19, every one of us we were suffered a lot, and from since month of February, and when the lockdown was announced, I can say that I can no one is escaped from this depression. I can say
Right.
no one escaped from the depression at one point of time they may experienced. And I'll
Yes.
give us some of the data, the facts about depression. I'll go with the presentation just.
Sure. Sure. Sure.
And as I said in the beginning itself, when you are introducing about what we are going to talk about it, you said that globally, nearly 264 million people are affected
Yes.
because of depression. And you cannot say that depression is only for adults, it is only for adolescents, it's only for youth.
Right.
No. Irrespective of that age group, it affects. That is the important thing we have to note down here. And another thing is on in the worldwide, when we take about the disability is nothing but we have the potential, we have the ability, but we are not able to make to harness that potential and ability, and we can call it as a disability. And depression is the leading cause for our disability, and it is a major contributor for. I think when someone is not doing, if I'm not doing anything, if I'm idle in my place, then when you look back and find out the root cause for the problem, the depression is the main root cause for the problem. And
Okay.
I think second, I'll give one more data here. When you talk about suicide in India, the
Yes.
suicide thought and suicide ideation is very common. And the second leading cause for death in India, second leading cause for death in India is suicide. And when you
Oh.
take that, what is the main root cause for the suicide? That is nothing but depression. Depression is the
Mhm.
main root cause for the
Right.
suicide. And one
Right.
more thing, the second question: who is more vulnerable for a depression, whether it is a male or
Yes.
female? When this question comes in our mind, I can say that here I'm giving that outline only. Women are more affected than men, and we will see that, and we will see the points later. Uh,
Right. Right.
as we said, now here is the point we discussed. We will move on to the next question.
Yeah. Thank you so much, Dr. Suresh. You have very nicely, briefly about it, depression, about the depression, and not only the particular age group is affected, but there are the childrens and the adolescent childrens, youth and senior citizens. They are also affected with the depression, and this depression cases is more increase in pandemic and after the pandemic also. Yeah. The second is the question I wanted to ask. Who is a vulnerable depression? And so
Yeah.
who is the these things vulnerable category? We can just say that.
Again, it is another interesting question need to be addressed
Okay.
here. And
Yes.
before that, I would like to give some intro about whether anyone can be exceptional from depression. No, it will affect in
Mm.
all the conditions, irrespective of individual socioeconomic status. Also, it will affect. And what kind of
Right.
changes it will make when you look at that, our interpersonal
Mm-hmm.
relationship. When the person is depressed, we can see that they may not have the good interpersonal relationship with others, and earlier they
Right.
may have an
Yes.
ability to interact with others, and the social
Mm-hmm.
life, the common social life, the quality of life comes down, and we can see that they cannot have that happiness, the strike balance between the work-life balance and the career disturbance will be more among the people who are depressed, and we
Mm-hmm.
can say, if I feel I'm self-worthy, if I'm having the self-esteem, and then I will do better. Otherwise, I will be dysfunctional. So these things we understand that depression directly or indirectly cause a lot in our daily life. And as you
Mm-hmm.
said, who is for more vulnerable? As you
Right.
said, India is the most youngest country in the world. Am I right? I think you all
Yeah.
agree with me. The reason is when you take that other developed countries, and when you take
Mhm.
that average age of that particular country, it will goes to nearly 35, 40 plus. But when India comes, it comes 21 plus. 23,
Oh.
25 plus only, the most youngest country in the world. Even China also, their elderly populations are more in number. But when it comes to India, the youth population are more. And when we take
Mhm.
that aspects, and who is the more vulnerable right now, and
Mhm.
youths are more vulnerable to depression. And many of the youngsters, as per my knowledge, for
Mhm.
example, to cope the stress, depression and stress and anxiety, the
Mhm.
youngsters what they will go for negative coping mechanism.
Mhm.
So negative coping mechanism, it is that smoking, drugs and alcohol, they think that it will help them to overcome or manage the depression. But actually,
Mhm.
it is like an incubation period, like seeding. Na? When you sow the seeds, at one
Mhm.
point of time, it will out. Likewise, when you go for negative coping mechanism, the particular moment you may feel comfortable, but
Yes.
later stages we can see that you will be addicted, and you will not you will be useless to that home and community as well as society. So these kind of things we may know that we have to understand that, and youth is the most vulnerable for this depression, and we have to understand that necessary for talking about the depression. Why we have to talk?
Mhm.
Because when we are creating awareness about the depression among the youth, for that, you see here, World Health Organization, every year they will celebrate an health day, World Health Day.
Mhm.
They will give a theme for that. But in the year 2017, they
Right.
announced the theme for the World Health Day is on depression. Not only
Right.
that, they given the talk, they given that how you can overcome the depression. They said that
Mhm.
depression, let's talk. For example, I'm having the problem. For example, I'm a person depressed.
Right.
If I share my feeling with you, okay,
Mhm.
you console me and you will motivate me. Don't worry. This is a short period of time. You will overcome the problem. I know personally these kind of words I will get it from you, and that will solve. That way they are insisting. Let's talk. And many of the
Right.
depression are become mild level. There are three levels of depressions are there: mild, moderate, and severe. When we
Okay.
know that the beginning level, mild level, the initial level, when the person having the space to express their feelings, and if they have the space for talk, and they can overcome the problem in the beginning itself. Otherwise, it is very difficult. That's why when we see that the most of the movie, if there is an accident, there is a doctor will come and say that if you brought the patients 30 minutes before, we can
Okay.
able to save the life. Likewise, here also,
Yes.
depression,
Yes.
when we come to know that the beginning
Mhm.
stage itself, when we know that the beginning stage, yes, this person having the depression, and it is easy for us to help them to overcome this depression. So
Okay.
that point, it is very important. We need to understand that. Let's talk to
Okay.
others. And one example I like to quote here. For example,
Yes.
when you look at that any hall or any room, if you enter and you can see that windows, why they
Right.
are having windows and doors? For aeration, am I right? Ventilation. Likewise, for us also, we need to have a ventilation. We have to vent out
Right.
our feelings. Okay. If we are having that adequate space for venting out, and we can able to overcome the depression, that's my best suggestion I can give you.
Mhm.
Yes, yes,
Okay. Thank you. Means you have just tell us about the youth. Mainly the youth are more affected, right? And the second is that we have to, through this platform, we to urge to the all the youth to talk, to
yes,
speak about your feelings, to speak about your emotions. Whatever you wanted to share, you can share. Don't be, sit alone. Don't be say that whether I say whether it is wrong or right. Don't be judge yourself, but you have to tell what is your problem, how the problem is affected to you. Then only you cannot, means you will not face this depression, stage or something. These things.
yes,
This is really, I feel very means grateful, this means guidance from you, that to all the youth, please, all the youth, please underline these things. Talk to your parents, talk to your uh, friends what the problems you are having, or talk to the counselors where you wanted to talk a free way, and where you will share everything in a confident way. Okay. So this is our one guidance and helpful, quote for the every youth people.
Yeah,
So I just wanted, yeah,
yeah, I would like to add on that. In addition to that, as I said, the most
yes,
vulnerable population is on youth. In addition to that,
right,
I would like to give on some more data regarding who are all affected in India because of
yes,
this depression. Here you can see, as per
yeah,
the global burden of disease, that they published a report, and they found that the depressive
hmm,
episode in men is on 5.8 percentage the world, but
okay,
when it
five,
comes to that woman, it is a 9.5 percentage. That means if it is an two women and one man, they are affected because of stress.
mm-hmm.
Two women and one man are affected because of depression. So that is an
Oh,
interesting data. And when it comes to that, another thing which was largely conducted in South India, that
okay,
is the one of the study they conducted with a huge number of population. So
yes, mm-hmm.
what they found that in a given time, how many percentage of people were affected with the depression? They found
Right,
that 15.1 percentage.
yes,
15.1 percentage among that socioeconomic status. For example, we may say that I'm a low socioeconomic status category or a high socioeconomic category. We may categorize whether there is a
mm,
difference. Yes, who are more vulnerable. That low, poor socioeconomic populations are more vulnerable to depression than that high socioeconomic status population. But it doesn't mean that they are not having that depression. Yes, there is a mild 5% difference are there, but they are also
mm-hmm.
depressed. And when it comes to that married population, when I think the marriage is an important cultural practice in India and
Right,
almost all the world we can see, and the
mm-hmm.
married population are having depression than that unmarried. And
Mm-hmm.
even the marriage, you can see that the
Mm-hmm.
divorce, those who are in the divorce, in the process of divorce, and they are
Yes,
experiencing more depression.
right,
4 out of 1, as I said in the beginning, 1 out of 7 is undepressed. But in the population of divorce cases, four out
mm-hmm.
of one out of four, 1 out of 4, one person are affected depression. And the
Right,
widowed, if they lost a partner, the spouse, and they also
mm-hmm.
experience equally depressed in their life. When
Mm-hmm.
married participants also express that, but which is less than that. But when compared the 10 percentage more among the widowed and divorced populations, this
Mm-hmm.
need to we have to keep in our mind. And another thing is on why we need to talk depression. Sometimes we may fail in expressing our things to others.
Right,
As I said in the beginning, most of the
mm-hmm.
youngsters nowadays, the media projection and wrong guidance from the friends, um,
Mm-hmm.
they they given an idea that we can go for substance use, and then that will turn to become a substance abuse, and they will be addicted to the different substances. And
Right,
as I said, when they were taking, they feel that they are overcome the depression. But if they are experiencing 1% of depression, once after that, it will go to 10%. Think about that. How many percentage are jumping? So that is
oh,
called, that way we can call it a negative coping mechanism. At that moment,
mm-hmm.
that's why they are most of the time they want to drink, they want to be there, drug or alcohol. And it is the
Right,
most important thing you have to consider. Don't go for negative coping mechanism. There are a lot of positive mechanisms are there. You will, that is the right thing I can suggest you. Yes.
mm-hmm. Yeah. One thing that I wanted to say that negativism, means when
Yes.
the feelings come the negative way, you should talk in that feelings, that stage. When I say I don't want to, this, when I say that this challenge or this I will not, I will not do that things. It is not in my hand. How I can do, so that the negativism when it comes in my mind, that only I have to just talk on this, and when the somebody will just take it in my ways that you are a positive, you have the positive, means positiveness in you, qualities are there, positive qualities are there, you can just take it that, and you can just show, you can just take that positiveness and just go forward in your life, then that will be these things. So that negative feelings when it comes, that time only you have to just stop that negative feeling and just be say that yes, I'm a confident, I can do it. Whether you can fail it. We know that, means, we can fail, and then only we can learn and these things. Okay, but at least you can just try it, and that will gives you a more happiness, these things. Good suggestion from Dr. Suresh Kumar. Thank you so much, Dr. Suresh.
I can say your observations are exactly 100% right. That we can say that symptoms of depression that
Right.
need to be discussed.
Yes, yes. Yeah. So my next question is, how we will come to know the person is depressed, or is it any, because we are in office, or we know we commit to these things. We don't know the next person is depressed, or when my friend is depressed, in my family members, they are in, sometimes I don't know that whether they are going through in a depression symptoms or this. How we can identify them, where we can just help them. Can you just flash on these things?
Yes, yes, Ms. Anaga. I think it is another important question. There
Yes.
are my family members, my friends. They may also experiencing depression. Whether I can able to identify or not. There are two ways we can able to identify. One
Okay.
is we are going for professional support, psychometric assessment by the trained persons. Okay, they will do the psychometric assessment and they will say that what is your level of depression. That is the one way. And another one is
Hmm.
um, we can see the symptoms of that depression. There are different symptoms are there for depression. Here
Hmm.
I'm going to show some of the depressions, and if you see these symptoms for there for 1 day or 2 day, you cannot label the person is and the person is depressed. No, these
Right.
symptoms must be the person must experience for a week and more than that. Then only you can name the person, label the person as a depressed. Otherwise, they are normal and they are experiencing these kind of things. And what are the symptoms we can see in a person who are depressed? And
Yes.
they will be more sad about any kind of activity they are doing in a day-to-day life, and their
Hmm.
the mood will be goes ups and down. Sometimes they will be happy, sometimes they will be very low in mood. And these are the symptoms we can vividly see by seeing externally. And usually they are very interested in some of the activities. When we look at them, for that
Hmm.
activity, they will lose the interest and they will not do involved in that activity. And they enjoy particular activities, even it may be eating or studying or whatever. One point of time they stop that, okay, I don't like it. That kind of thing we can see that we can see that. And other symptoms I would like to change here.
Hmm.
They will not have that take that appropriate food. Usually they have the particular quantity of food item. The quantity will change and the time will be changed. So that is another symptom we can see the depressed population. And
Hmm.
having the trouble in sleeping also. And there are two ways we can find out. One is they take less sleep or too much of sleep. These are the two conditions we can see. And
Hmm.
last, they will be more. Most of them they feel more tired and fatigued. They feel
Oh.
more tired and fatigued. We can see, and they lost the energy. And we can see they are low energy. We can find in a person who are depressed. And when we look at the speech given by them, and there are it may be slow down and we may not get the meaning out of that speech, and they will not have any purpose in that purposelessness, which is very common. They have the mindset, hey, I'm here. So that kind of talk they will we can see in a person, and they have more kind of guilty
Hmm.
feeling they may have. No, I'm not useful for anybody else. They feel that worthlessness. They say that
Hmm.
I'm nothing, nothing good for nothing. So these kind of thing we can see in a person. And when you look at that, as he said, depression is the main root cause for suicidal ideas, suicidal thought.
Yes.
And
Yes.
these people having the thought of death, suicide, and self-harming and other things we can see. And
Hmm.
not only that, their concentration and making decision and solving the problem, and this will be our troubled one, and they may not show
Hmm.
that appropriate level of ability. So these were the symptoms we can see. If we see these kind of symptoms, our family members, our friends nearby us, and we can understand that the person is depressed. And
Okay.
we, as a person, we want to help the person. Don't discriminate the person and understand that they are undergoing some traumatic experiences, depression, and they will come out that when you give that proper support to them.
Yes,
So
proper support.
this way we can able to understand that what kind of problem they have. Yes.
Right, that is true. So the proper support, that is a main, word in all this discussion. Uh, Please make sure for this is for the parents, that when you are dealing with your children's, please see their activities. Please talk to your children, because sometimes in adolescent age when they comes, uh, parents will not understand their child, or the children will not understand with the parents. So please, parents, talk to your children. And the second thing, that be a supportive for your child at any conditions. Okay.
Yeah.
Dr. Suresh, we have questions from Lakshmi Rajan. Can you please give some tips to overcome a depression? I'm just coming that
Yeah.
question. It is a
Then,
very good question. Yes.
yeah, it does need to be done by right time here. And
Right.
we not when you want to take care of the depressed person, not only understanding the component, we must know what is the appropriate treatment for depression. We must know that. Um, so I would like to share some of the treatment plan for overcoming the depression. One is on medication. So
Yes.
medication done by clinical psychologists or psychiatrists only. So what we can
Okay.
do that we can refer them to the nearby trained professional. That's the one way. And another one is psychotherapy. And
Right.
psychotherapy, there are psychotherapy has many techniques. There are different
Right.
approaches. Are there. We can add up appropriate psychotherapy for dealing with the depression. So that
Hmm.
will be most effective one. And I can say nowadays the light therapy also predominantly used.
Hmm. Hmm.
The
Hmm.
more fluctuations and depression is only because of lack of exposure to sunlight. And when we take the Indian continent, and we are not having such a problem, but when you look at that, some of the place they may not have that much exposure to light. So for
Hmm.
them,
Hmm.
we can do artificial light therapy that will help them to overcome the depression. That is another which were proven one we can use it. Even here also, sometime in the cold some winter time, and we may feel more fluctuation. That time we can have a light exposure to the person,
Yeah.
and that will help them to overcome the depression. Another one is nowadays alternative therapy. What is
Yeah.
alternative? I can say that and the breathing. Dr. Lakshmi Rajan is there, and she is very good in that guided breathing, guided imaginary mindfulness practices. So this will help us to handle effectively our depression. So this is
Okay.
one component, and another one is I can say that music, alternative
Hmm.
therapy, music therapy, aromatherapy. Aroma, there are sometimes we may feel that when you smell particular thing, we feel more calm. That's why when
Yes.
you are praying now, that time in the scented candle will be burned, and when you smell it, we feel more calm. But certain
We.
that will stimulate our sexual stimulation also. That will do some kind of thing. But certain scent that will make us to calm. So we can do that aromatherapy, music therapy. We can do that for alternative therapy. And
Hmm. Hmm.
important thing I can say, from your side, without any other person's support, you can do exercise. Many
Right.
people wonder how exercise will help them person to overcome the depression. I can say yes. When
Hmm.
we do
Hmm.
exercise for 20 minutes, 20
Hmm.
minutes,
Hmm.
and there is an hormone called endorphin will be secreted. That is one of the neurotransmitter. I think
Yeah.
when you have the pain in your joint and your body, the doctor when you go
Hmm.
to the doctor for painkillers. So I
Hmm.
can when I was a medical rep, I know some of the medicines, diclofenac like that. Okay, when you take the medicine, so they will say that you to painkiller, but naturally, but these painkillers are artificially stimulating your endorphin. But
Oh.
naturally, you can do that when you do exercises. The
Hmm. Hmm.
best way you can get rid of depression, I can say. As I said earlier, when we were used to go for alcohol and drugs, in the beginning stages, we feel enjoy and you feel more elated, addicted to the dopamine because of
Hmm.
dopamine
Hmm.
release. But after that, it will increase your level of depression into multifold. So try to avoid alcohol and drug uses. And another
Hmm.
thing, be an assertiveness is also one of the important quality
Hmm.
to overcome the depression. Say no. For example, I can able to work some extent only. If I'm beyond that, I can't do that. I have to say that stop here. I can't do that. And finally, we have to take care of ourselves. No one will come and help us. We have to say that yes, we, our body is ours, mind is ours, our emotions is ours, and we need to be happy. And most of the time, we have to take care of it. And you have to, for example, when you look at that any vehicle, that there is an engine will be there. Look at me every day. So there is an word will be there. That means that driver and the person who are handling, they have to do. Likewise, you have to write it in our head. I think so. We have to take care of our body. So that we can able to overcome these kind of things. And these strategies are very useful for us. In addition to that, we can go for natural therapy. Natural
Okay.
therapy. Recently, there were studies that proven that when you are
Mm.
more connected to nature, you can
Right.
get rid of depression, stress, and anxiety. That's why when you see when you are more anxious, they will ask them to look at the green colors.
Ah,
You can ask
right.
the elderly population without knowing that meaning of. But now the research findings are proven that, and when we were more connected to nature, and we can overcome the depression and stress.
Right.
And appropriate diet and the food item, fatty acid, omega 3. So this will help us. The food and diet is in support. We have to get it. We know that. So
Mm.
these are the initiatives they can take up to overcome the depression. I hope my inputs are useful for overcoming the depression. Thank you so much for the opportunity.
Yeah, thank you so much, Dr. Suresh. You have given how there are the many therapies where you can, keep yourself happy, keep away from the depression feelings and these things. Okay, thank you so much. My next question is
Yeah,
how to
thank you.
overcome depression from a daily life, because daily, because when I got up I saw that I have to go to the office, then that strugglingness, my children, then everything, the person, feels that, Array, I'm not complete my target and these things, my daily target is not completing. So how, can you just give us the tips and in the some for the housewives also, how they can just, keep their children happy, keep themselves happy this way?
Okay. In addition to that, Lakshmi Rajan question is an extension to daily life. Okay. In daily
Okay.
life, I think when we know that root
Mm.
cause of the problem,
Okay.
depression, we are having that there are many symptoms, there are many causes are there. I can see that one is about the environment. I'll tell
Mhm.
you to take care of our depression. One is in our daily life.
Okay.
The environment, one of the environment will be the cause for our depression. And another one is genetic. We are not having any control over it. Genetic is a determining factor. And another one is brain chemistry, as I said, neurotransmitters. The
Okay.
neurotransmitter imbalance in neurotransmitter that will create more stress. I can see when we are
Mm.
connected to other people, there is a hormone called oxytocin will be secreted, and
Okay.
the feel good hormone. And when that way we human beings are social animals, we need to interact with other
Mm.
people. And when we are doing it in real life, and we feel more comfortable, and we can be able to overcome the depression very effectively in daily life. Definitely, when we plan that, go for time plan, goal setting. In the day, I'm going to do that. And another important thing I can say that live in a moment.
Mhm.
Don't think about your past and future. The moment is
Oh,
for you. Enjoy the moment and then go ahead. So this is the way you can manage your daily activities to overcome the depression.
okay. So Hitesh is also and Dr. Lakshmi is also giving you the thanks for the wonderful sessions. I really thankful for Dr. Suresh that on this collective in platform you have given, means you explain what is the depression and their definitions, and what is the, we can just how to keep ourselves happy, this thing. So collective, I just wanted to urge here, collective in delicately to be part for the freedom project, the collective in freedom app that provides online counseling to any patient and from anywhere. For the safety and the privacy of patients, the collective in technology is HIPAA compliant and brings you a gold standard experience in counseling session without worrying about anything, and giving you access to a team of experienced professionals like Dr. Suresh Kumar. We also have 24/7 toll-free helpline number, that is also a suicide prevention helpline number. I just wanted to urge to each and every person, please make this number, make note this number in your mobile, or write it in diary: 080-456-99018. And I would urge you to reach out to us at any time when it concerns the mental well-being of you or others around you. Again, I wanted to tell you helpline number. Please mention 080-456-99018. Thank you so much, Dr. Suresh Kumar. Uh, Really thanks that on this platform you have support to our all the audience through your legend, study and your counseling. And Dr. Suresh Kumar is also one of the panel counselor of Collective Win. Thank you so much once
Thank
again
you.
from Collective Win, all the team. I'm really thankful to you. Good
Thank
night.
you. Thank you.
Thank you. Thank you so much.
Thank you for the opportunity also.